Hey guys, Dr. Tim Uselton here with Trinity Integrated Medical, and today I was going to talk to you about the differences between phasic muscles and postural muscles. There are different types of muscles in the body, but I'm going to focus in on these two types of skeletal muscles, the muscles on the outside of our body holding up our skeleton. So phasic muscles are muscles that go through the full range of motion. So they go through each phase of movement. That's how you can remember that. A phasic muscle has lots of movement with it. Also, a phasic muscle, it's available on demand. It's not just opposing gravity. I'll talk to you about that when I get to postural muscles. But the phasic muscles, not only are they available on demand, but they're a fast twitch muscle. So you could literally move them super fast and they could be movers of your body. And then the last characteristic I'll tell you about is that they have a tendency to become weaker, okay? Now, that opposed to the postural muscles are a deeper layer of muscle. When you pull off the muscles like the traps muscles and the levator muscles and the rhomboid muscles and the deltoid muscles that work on your shoulders, and you take all those off of the body, then you have another layer of muscles there, and they usually run in this direction right beside the spine, and they're a deep, deep layer, and they're called the postural muscles. Postural muscles are kind of the opposite. They're a slow twitch muscle fiber, and they oppose gravity. Like when you're upright and in an erect position with good posture, those muscles are what's holding you up. And so it's very important to know that they can be injured if you were to get in a car accident or you were to fall down and compress the bottom of your spine. It would actually send all that pressure up to where the occiput, the skull, meets that top vertebrae. Another important thing to note that right inside of here is where your brain stem is, and the brain stem is what actually controls and activates your parasympathetic nervous system. And now that's a big fancy word, but what it means is it's like the resting and digesting nervous system. So when that kicks into effect, it's when you're like digesting a big meal, you're laying down and relaxing, and your breathing starts to slow down, and all those things happen. Your actual blood pressure drops a little, your pulse rate drops a little bit, your respiration rate drops a little bit. All those things are happening because your parasympathetic nervous system is kicked in. And if you have an injury, like a whiplash injury, that started with just, ow, I got hit from behind and now my neck kind of is sore. Well, over time that compresses and it'll cause you to not be able to really rest or digest well. And so when we start to work on these areas and try and help you with your pain, which is the common complaint when people come in here, they don't necessarily come in saying, wow, my digestion's bad now, or I haven't been able to sleep. Sometimes they say they haven't been able to sleep, but normally it's my neck hurts, okay? And so when those things happen, what has happened is your postural muscles have been damaged, and now they're not wanting to hold your head up, okay? And so what happens is your phasic muscles, those muscles that are fast twitching and not designed to just oppose gravity, they actually start to assume the properties of those postural muscles, okay? So again, there's postural muscles that just hold you upright. Kind of like if you had a tree that was leaning over and you went and staked down a rope and you pulled it back and then you put the stake in the ground, and now you have a rope that's holding this tree up into a straight position. Okay, these muscles are holding your body in this upright, straight position. That's all they really do. So when they get injured from a whiplash type of injury or various other types of injuries, falling on your back or falling down and hitting your head, falling downstairs, missing a step and jarring things real hard, any of those things can cause the initial onset of the strain of those postural muscles. But over time, even when your pain has now reduced and weeks have gone by, these muscles are starting to hold the head up into a good position, and they get fatigued really easily. It's kind of like if you held, this is a 12-pound head. It's like a 12-pound bowling ball. If you were to hold that bowling ball real tight up against your belly and walk with it while you carry it, it'd be a whole lot easier than holding that ball out, say, balanced in your hand like this, where your bicep was doing all the lifting. So that's a phasic muscle, and it would fatigue very, very easily, and you would be shaking because you can't hold that 12-pound ball. Even if you're super ripped and big muscle guy, you can't hold that ball very long. But yet, our postural muscles are able to hold our head up for 18 hours with no problem. Never do we stay up all night and then get to the point where we can't hold our head up because of fatigue of these muscles. We may get tired and doze, but I'm talking about these muscles not having the ability to hold your head up. It very, very rarely happens. When they weaken or have been injured, they recruit these phasic muscles to then start doing the job, and then those phasic muscles start to assume the properties. Now they don't twitch as good as they did. They start to get little fibrous adhesions that kind of lock themselves to hold that potential losing of the head off the front. That's a very, very important point, because if anyone's ever gone to a massage therapist and they've got knots up here in their back, it could be because they sit like in this posture all day while looking at a computer screen. Maybe they're typing. And those stretch, strain type long-term repetitive injuries are what's going to cause some of this problem. But they go to the massage therapist and they start to work these knots out, and they say, man, you've got lots and lots of knots. It's like there's a big, massive scar tissue in there. What has happened over time is those fibrous adhesions have locked onto one another, and they don't let go very easy. It's like putting a comb through the hair on the back of a dog who's got matted hair. Like, it doesn't comb through it very well. And so that mat is what's happening here. And the only way we know to really, really fix it is to do what's called trigger point injections. Trigger point injections are very important because the misnomer with those is that they're used for pain. They're not used for pain. They're used in the presence of trigger points. Trigger points form when scar tissue is holding a phasic muscle in the position of a postural muscle, doing its job, doing the wrong thing, not what it was designed to do, but what it's been recruited to do because of an injury. So I hope that makes sense. We use trigger point injections. We go into the center of the little muscle knot in the scar tissue, and we put a little bit of lidocaine with an injection, and that lidocaine expands the capsule of that little fibrous adhesion. And over time, after 2 or 3, maybe 4, on really, really severe ones, it's blown up that capsule enough to make it kind of dissipate. That's why you go back week after week after week to the massage therapist, and you could go for 10, 11, 12 weeks in a row, and they would find the same knots because they're not truly getting rid of them. They're bringing some blood flow into the area, and they help, and it feels like you're relaxed, but then you go right back to work, and you go right back to the stress and that old injury from when you fell when you were a kid, or in that car wreck when you're in college, and it comes right back in those fibrous adhesions. Hold on, because these phasic muscles are afraid the head's going to be lost off the front. So that's the reason why we do trigger point injections. That's the difference between postural muscles and phasic muscles. I hope I've made it easy enough for you to understand. But I hope that, if you ever have the need for some of these trigger point injections that will break down those kind of permanent knots that you've had forever, then we can do that. It's, even if you're a needle phobe and you say, yeah, I can't do injections, most people that tell us that after they wind up getting them, they say 2 things. They say, 1, it wasn't as bad as I thought it was going to be. And 2, I wish I would have done it long before because it felt so much better after those triggers were broken apart. So that's trigger point injection therapy, along with the reason for that postural versus phasic muscles on this video. And I hope you enjoy the videos, and I've got more for you to watch. So take care and have yourself a great day. Dr. Tim here.